good night and welcome to a new edition of today's Youth. We're very pleased to be with you tonight in a very special edition of the program. An edition that concentrates on one of the very important topics that are of great interest to the youth today. A lot of the new adolescents of this new generation are suffering from problems with their weight. A lot of them are actually very concerned about their looks. Some of them are actually want to imitate great stars and the people they are fans of. But many are having overweight problems, and a lot of them actually suffer in the process of getting to that ideal look they think it is. So today we're going to discuss this problem in further details from a scientific and practical point of view. Stay tuned to learn more about it. To learn more about the problems of obesity and plastic surgery, you are very honored to have with us in the studio tonight two of the doctors and professors in this field. We are very happy to have with us Dr. Munir William, Professor of Plastic Surgery, a very warm welcome, and also Dr. Musad El-Ghatwari, Consultant of Endocrinology and Obesity. Thank you for being with us tonight.
Thank you.
So, as I've introduced the topic of tonight's edition, it's actually a problem that is making, an issue for a lot of youth today, being overweight. Maybe it's interesting at the beginning to have an understanding or identification of obesity. What does it mean, Dr. Williams?
Obesity means that there is massive production, increased production in number of fat cells in the body, in relation to the corresponding age and weight and sex. Mm-hmm. We have to differentiate between obesity and what is known as edema. Edema is just accumulation of fluids inside the body. This edema is not obesity, but obesity, there is either accumulation of fat in the form of increased number of fats or increased size of fats. There is increased number of fats before puberty, mostly. And there is increased size of fat after puberty, mostly.
Mm-hmm. So that's actually directly connected with adolescent age, before and after, and in both cases we are having a real scientific problem with the body.
This is a critical age in order to start to speak about obesity. Mm-hmm. And even in the line of treatment, if there is a plastic line of treatment, surgical plastic line of treatment, age of the patient is very important to decide and determine what to begin and which type of operation to do.
Mm-hmm. So actually operating on youth is also a solution. It could be...
yes, of course.
Okay, yes. Excellent. Maybe first we need to understand what is really the difference between being overweight and being obese?
In fact, to start with, there is, as Dr. Munir said, hypertrophic and hyperplastic obesity. I mean, there is some people, they have the same number of fat, but increase in the size of the fat cell. Mm-hmm. Others are born with great number of fat cells, so we have hypertrophic and hyperplastic obesity. Before, we used to define obesity by body mass index, and till nowadays people are using body mass index. Recently, the WHO found that obesity is related to the circumference of the abdomen, waist circumference. They decide, or they define, that for females, if the waist circumference is 80 centimeters, she is normal, or below. From, say, from 60 to 80, this is a normal. From 80 to 88 centimeters, she is going to be overweight. Above 88 centimeters, she's obese. For males, they found that 92 centimeters is the normal. From 92 to 102 centimeters, this is overweight. Over 102, this is obese. Mm-hmm. Why they choose the waist circumference? What we are afraid, obesity is associated with some risks. They found that if you have this body, this waist circumference, you are at risk. That's why they related obesity to waist circumference. Besides what Dr. Maurice said now about fat cells.
Okay, so this is the criteria that is internationally recognized as to differentiate between the different body mass index, or actually the waist circumference.
I'd like to simplify this by saying that we say that the number of fat cells in the adult male is about 2 times 10 to the power 9. And in the adult female is 4 times 10 to the power 9. So, before puberty, this number is fixed. So, there is increase in number of fat cells till reaching this number. The baby is not this number. The baby is small number and started to division, as Dr. Mossad said. There is hyperplasia. The hyperplasia means increased number of fat cells till reaching this number. 2 times 10 to the power 9 in males and 4 times 10 to the power 9 in females.
It's a normal process to grow.
Yes, this is before puberty, till adolescence. After adolescence, the number is fixed, but there is hypertrophy. This means there is increase in size of fat cells. So before puberty, there is increase in number of fat cells, what is known as hyperplasia. After puberty, there is increased number of fat, there is increase in the size of fat cells, what is known as hypertrophy. This is number one. Number two, Dr. Mossad said that we are trying to speak about the abdomen for risks for the body, risks on the heart, risks and so on. But from our plastic point of view, we are looking to the body as a whole. If there is accumulation of fat in certain special places, such as hands, lower abdomen, this is certain type. If there is pendulous abdomen, as a female, multiple pregnancies, or as a male who was athlete and then stopped being a player and returned to have pendulous abdomen, the second type. Or there is morbid obesity, where there is distribution of fat all over the body.
So these are the 3 types of obesity.
Okay. Yes. But from the medical point of view, as Dr. Mossad said, he is trying to speak about the abdomen for risks on the heart. From plastic point of view, we are speaking about the body in 3 certain types. You see?
Excellent. Yes, of course. So now we've understood the different types of obesity, how you can define yourself, whether you're a normal weight or overweight or obese, and the recognized ways of actually determining that. Now, of course, for our viewers, you can always contact us live with your questions on 2579-4828 and throw your questions to the floor to our experts tonight. Any question you have, you can ask us, as we've just written, on obesity or plastic surgery. Would like to know fast, why is it especially with youth that they are very vulnerable to being overweight? I know that a lot of people also have certain stages in their life when they are actually prone to gain weight, like what you've said, ladies who've been pregnant and just given birth, they usually have from 10 to 30 kilos extra weight. But when it comes to adolescence, that's an age also that is very vulnerable to this change in the body. So why is that?
Media. Media, you know the role of media, westernization of life, like before, we used to walk, we used to go upstairs. Yes, no, not exercise. I mean our daily activity, normal daily activity. We used to walk from here to there. We used to cook at home, but nowadays, due to more these fast food chains everywhere, and the role of media, which attract, if you buy one, you will get one free. So
we are the culprits. Okay.
So this contributes to the problem, or to increase the magnitude of the problem of obesity in adolescents.
What Dr. Mossad said is number one, and this is related to the media. But we have not to forget. Number one, congenital rule or inheritance rule. What is meant by this?
Inheritance.
Yes, inheritance. We find certain families, there is obesity. There is maybe obesity in the area of breast. There may be obesity in the area of hunch. These are passing in families. This is number two. Number three, rule of hormones. Don't forget
this inheritance rule, is there any way we can solve it, or is it something that you've got to live with? I mean, are we talking about just obvious factors that lead to obesity, or is there a way to handle this issue?
We have to handle with, of course. But there are certain types we have to handle by many means, either exercise or diet control and so on. Or
So this
even
also
surgery.
can affect the hereditary problems.
Of course.
Okay.
Number 3, don't forget hormonal rule. In adolescence, there is hormones, the role of hormones, females and males, and stars certain types of hormones to play inside the body, and we find distribution of fat starts to be distributed according to this. So there is media, there is inheritance, there is hormonal rule. All these play a role in obesity.
So actually there are so many factors that lead to this being overweight, but what about the, young people today, as you've mentioned, are very obsessed by, of course, the media and the ideal persons. Would you say that this is an issue that actually affects their behavior? I mean, psychologically speaking, is this also an associated factor, or is it only on the scientific and normal development of the body?
Let us say nowadays our sons and daughters, they have two factors pulling them, each one pulling opposite, you know. One is fast food and this change of lifestyle, etc., etc. The other one, the media also play good role in showing the magnitude or the risks of obesity. So you find in our clinics, we find in our clinics, these adolescents come to lose weight or to reduce weight, and they are trying to reduce weight. Once they reach their target, then they restart again to eat, so to increase weight again. So, I mean, it's a very difficult issue to decide whether to reduce or to increase. So they are going from here to there. What we do is we try not to press on them with no, don't do, no. We try to encourage them to lose weight by temptation, you know. If you want to get soft drink, okay, you can get this low calorie. Or if you insist on getting the normal, you can get half.
Okay, so you give alternatives.
Right.
So that
yes.
they
It's compromise.
Okay.
From my own opinion, that in order to decrease body weight, we have to follow 3 lines of treatment. First line is diet control, as Dr. Musa said.
Okay.
This is first line, but alone it is not. It is still less. Second line of treatment is exercise. Third line of treatment is a will. There must be a will that obesity and decrease weight is a style and manner of life. There must be these 3 lines together. Diet control, exercise as a mode of life, and third one is a will to continue by low weight for life.
But,
it's a manner of life. It's a style of life.
But maybe this is actually the issue I'm talking about. It's very important to balance between all these 3 issues or factors, and at the same time they are very important. What I'm arguing is maybe because the wrong incentive is given to people. It's the incentive of wanting to look the ideal look of a star, and not actually having the main aim of being healthy and to keep a good body until the age of 60 maybe. Maybe it's because of this miscommunication of the message that makes them, like Dr. Mossad says, follow the diet until they reach the look they want, and then once again they quickly gain weight. Could it be a problem, or is it maybe, I mean, the wrong will, the wrong incentive, objective? What do you think?
Let us say you should give incentive, but it should not be like a bribe.
Okay.
Okay. Let us encourage them. At the same time, let us show them the risk and let us them little bit frightened.
Exactly. That's what I mean. Awareness, of the consequences.
Right. And recently, to my astonishment, I've read some
studies.
Reference. Yes. That if you walk 4 miles a day for 1 month, as you drop a piece of toast from your diet.
Okay.
So exercise is very important, but also diet regimen is important. and it should be some communication between you and your, we can't say patient, your customer, your client, or your son, your daughter. Some communications, you know, you should encourage him or her at the same time, and should make him frightened from the risks on the other side.
Mm-hmm.
Okay.
Excellent.
I'd like to continue as for exercise.
Uh-huh.
What is the role of exercise? Exercise is very important. Why? Number one, it makes destruction of fat as a source of energy. This is number one, by exercise.
Mm-hmm.
Number two, it prevents precipitation of low-density triglycerides on walls of heart and doors of vessels, so it prevents cardiac attacks, brain attacks, hemorrhage, and so on.
Mm-hmm.
Number three, exercise makes absorption of fat from muscles less than absorption of fat subcutaneous under the skin.
Mm-hmm.
So the body becomes more stronger. So exercise is very important.
Mm-hmm.
But unfortunately, once you are good in dealing with exercise and then stop suddenly,
Uh-huh.
there
They
is,
gain weight a lot.
yes, there is a problem, huge problem. We find all muscles of the body will drop.
Mm-hmm.
There is pendulous abdomen, there is lax skin, and so on.
Mm-hmm.
So exercise is very important to be done, and it must be as a manner of life. It's a lifestyle.
Mm-hmm. That's indeed the big message that we should all think about. Being healthy, not being obese or overweight, is a lifestyle. It's not a matter of a certain medication or a phase of life you go through. It's a lifestyle you have to always follow.
But if you allow me just to
Of course.
whisper into our daughters and sons, if their weight is over 90 kg, it's not advisable to do exercise while standing,
Mm-hmm.
because you are pressing, you are making effort on
Pressure,
the knees.
Okay.
Exercise is important, like swimming.
Because the body's in a way floating.
Right,
Okay.
right. Until he passed to, say, 90 kg or so, we say 90 roughly,
Mm-hmm.
then he can walk and this. And exercise, the best exercise, if you are allowed to do walking, is to walk until warm and sweat, provided you do not walk in the sun.
Of course, that's another factor. Okay, so that's the stage when you have to stop walking.
Yes, until warm and sweat. Until warm and sweat.
Sweat, because I've heard that you actually have to warm up a little bit, and then your body starts to actually burn
You
calories.
just walk steady, and there is difference between activity and snake activity.
Uh-huh.
You know, snake walk like
Yes,
this.
yes.
Snake. So you walk 5 minutes and then you stop on some malls, and then you walk and then you stop greeting somebody. No.
That's
This
correct.
is snake activity.
Uh-huh.
But activity is straight walking
Okay.
until warm and sweat. And they found it between 20 and 40 minutes average.
That's 3 times a week?
5 days a week.
5 days a week?
Yes.
That's the ideal.
This idea.
Okay. Dr. William, you have something to add?
Yeah.
Yes, I agree with Dr. Mus'ab for walking.
Mm-hmm.
And there is research said that normal walking for continuous, for 22 minutes is sufficient.
Mm-hmm.
But this is daily for life, 22 minutes at least. Now, as for diet control and exercise control, if there is no will, there is a problem, as Dr. Mus'ab said. The patient starts to gain body weight, and then loses body weight, and then starts again to gain body weight, and so on, makes like a yo-yo.
Mm-hmm.
And then we find problems. What are these problems? The best problem is what is known as stretch marks.
Of course.
We find stretch marks, and these stretch marks, we find it usually in our work. These are related to the yo-yo technique.
Mm-hmm.
The patient starts to gain weight, and then diet control, and so on. However, diet control, as you, or whether he is a good exercise, make exercise and then stop suddenly.
Uh-huh.
Usually we find these stretch marks which are very difficult to be treated.
Uh-huh. But actually, that's when plastic surgery comes in. A lot of people actually don't have the will to exercise, don't have the will to follow a diet strictly with a professional doctor. So basically, they think it's the easy way to go. for plastic surgery, because this as well helps with such negative effects with the body, like stretch marks. I think they're going to have, you know, their skin back to normal and stuff. Is this a correct notion, or the plastic surgery should be like a last resort?
This is not correct.
Mm-hmm.
Plastic surgery is not the rule. It's not the end result. If the patient still the same style of life, we will find other problems which are coming later, and he
Even
need
after.
for multiple operations and so on, and it's not not good. This is incorrect.
So basically, it shouldn't be the way to go just straight for plastic surgery to lose a big amount of weight and then gain them again. This is wrong.
This is wrong. Plastic surgery plays in many techniques and in many ways. I don't like the patient to enter inside the plastic surgery. Plastic surgery should be the last. If the patient is going on diet control, exercise control, and has a will, he will not be in need for plastic surgery.
Excellent. And we definitely wish that no one would actually have to go for that unless it's really required. And we're going to ask our doctor indeed, when is it a necessity? We have Abdurrahman online. Hello.
Well, hi. How you doing?
Fine. Thank you very much.
Well, I think I just want to say something. I think keeping exercise always is really important because, I mean, as, you know, youth have to take all the energy out, you know, instead of, you know, smoking drugs or doing bad things. You know what I'm talking about?
Of course.
Yeah, that's what I just wanted to tell you. You know?
Thank you very much, Abdurrahman.
All right, you're welcome, man.
Thank you very much. So actually, this is a very important point indeed. The fact that youth today tend to, lack exercise as a lifestyle indeed. And I think with the high tech that they are living with, sitting in front of the computer all the time, having to go through cars and transportation and not walking like the prior generations, I think these are all factors that also, add up to this weight problem. Don't you think so?
Of course.
Stress also, if you allow me, Dr. Munir. You know, also stress. Some people, when they are under stress, they start to eat. Binge eating, they start to eat. So also, you know, the stressful situations in our life nowadays are more.
Unfortunately, this is very true.
Also, the absence of leadership in their life, you know, in their social life. The model, the good model. So they tend to go to eating, yes, something like that. Also, maybe these factors not evident or clear, like westernization of life, fast food, etc., etc. But this also plays role. That's why exercise, even if not going to decrease weight or to help, it will help them to stop bad habits like smoking, etc., etc.
Definitely. So this is another positive point to be added to exercise.
Our friends spoke about drugs. As for mode of action of drugs, there are two modes of action. First mode is certain types of drugs play exactly on stomach. I mean, they prevent absorption of fat and food from stomach and from GIT. This type of drugs is preferable.
Preferable?
Yes. Second type of drugs play on the brain, play on mediators. This is not preferable. Why? Because there are many side effects, such as insomnia, nightmares, loss of weight, tachycardia, cardiac problems. All these are, and unfortunately, these drugs which are playing on brain, they are very expensive and very unpreferable.
And they are sold in the market?
Yes.
Even though the side effects are well known.
Here lies the problem. But drugs which are playing on the stomach are good for body loss. I think we are agreeing.
100%, I agree. Even some drugs, we do not like to use the term of drugs because drugs may be referred to something else. Some pharmaceutics, after they launch all over the world and they make a very big
sale.
They did not sell. They make a very big launch and say this is a promising drug.
Okay.
Then they found some suicidal tendency as a side effect. So they start to withdraw again from the market. Unfortunately, some of these drugs are available OTC. I mean, you know, OTC, I mean, if you go to the pharmacy
you don't have to
and
have,
say, I want to lose weight, okay, you take this.
Yes, you don't have to have a prescription from a doctor.
And not only they affect, as Dr. Munir said, the brain, etc., insomnia, but some of these drugs are contraindicated with people of hypertension because they tend to increase their blood pressure. So we use it in a very, very narrow sector. It's not treatment of obesity. It is for some narrow sectors just to push them, then you stop. But drugs working on GIT, I mean pharmaceutics working on GIT are much, much better, less side effects, and they give results better than these drugs or these pharmaceutics which we use work on the brain.
But then I would have the question, since it is very well known the good effects of this one and the bad effects of that one, even though it is expensive, as Dr. William told us, why is it that people tend to go for the expensive and harmful pharmaceutical?
Who will tell them about this harmful? I mean, if Dr. Munir or me did not talk, or you did not, media did not show, later
they would never know.
Because, you know.
But what about the pharmacists? Don't they have campaigns to actually make them know the difference?
But this drug is approved according, you know.
There must be a restriction by Ministry of Health. There must be a restriction for these drugs.
Maybe
and
it's difficult. Maybe it is difficult, you know, but the problem is to launch the drug, you have some phases you can go through. If you fulfill these phases, so drug is approved. If drug is approved, Minister of Health cannot
do anything
it's approved.
about it.
This is, I mean, if there is no the media or you know, religious people, mosque and church did not play role, schools did not play role, then we cannot stop.
I'm not agreeing with you, Dr. Mas'ad. There must be a rule of Ministry of Health for these drugs. These drugs are contraindicated. You see, problems of renal failure, problems of cardiac failure, problems of all these diseases which are present now, all these problems related to misuse of drugs.
May be difficult. Maybe difficult.
But I guess I would agree that anything from the pharmacy should be approved first by a doctor. It should be prescribed first. I don't think it's actually okay to allow anything to be just sold by a pharmacist to somebody who doesn't know, who's not aware of the side effects of any drug. I would say it's a problem. It's an issue we have here in Egypt. I mean, when you go abroad, it is very limited, the number of things that you can actually find easily available like this, and it's usually on a supermarket rack and not in a pharmacy, professional medical one. We have another caller. Hello?
Hello, Miss Micah.
Hello, hi.
I'm fine, thanks. Please, can I say what I want?
Of course, go ahead.
I think that sugar comes from cake. Cakes are dangerous for health. So we could stop eating cake. We have to control ourselves. Also, we have to control ourselves. So what we need from food? When we are eating, we must control ourselves. So normal body, so when we have normal body to control ourselves, from food, we have to drink water and clear our system from fat. We should ask ourselves, do I am overweight? And some people, in the amount they have muscles and body and tends, and they replace it by fat. Also, we have to ask ourselves another question: how much food and so energy requirement represent?
Okay, thank you very much, Ayman. These are very good questions to ask indeed, and I guess the point you've mentioned about water is indeed very vital. But I would actually address the question to my doctors and professionals here. He started off with a very interesting notion that sugar comes from cake and we shouldn't eat cake. So I think there should be a balance, but we shouldn't totally omit sugar from our body. Is that correct?
Right. Nothing forbidden. Everything is allowed, but with amount, reasonable amount, which is related to activity or job of the person. So We can say pancake or stock cake. No, you can eat a piece of cake. And you know,
And then go exercise.
Diet comes from the Latin word which means live happily. So if you eat some food, it will make you happy through some centers in the brain. That's why people like to eat. So we can allow, but according to yes, they ask about calories from 20 to 30 kilocalories per kg body weight, according to his exercise, according to his activity. I mean, if you do mental work, you need more than if you do physical work.
Is that true? So
Yes.
that's very interesting for students who are actually studying all the time.
Right.
But
right.
but what about the fact that they are seated?
No, they
seated all
should
the
move.
time?
I mean,
They should move.
provided they should move.
Okay.
Our friend spoke about water.
Uh-huh.
Water is very important.
Indeed.
To start with, there is no calories in water. Water calories is 0. But water has to be taken just before meals by 20 minutes. Why? In order to enjoy the abdomen and make fullness for the abdomen, for the stomach. So water can be taken before meals by 20 minutes. If taken inside the meals, it is appetizer. It makes more eating. So it is contraindicated to be taken within
During
meals,
okay.
but can be taken after meals.
20
so
minutes
water,
also?
No, just after meals.
Okay.
So can be taken 20 minutes before meals, or can be taken just after meals, but it's better not to be taken
During
meals for fear to being appetizer.
Okay.
It increases eating, increasing body weight, and so on.
So that's a very interesting tip indeed. So water, as much as it is important when it comes to eating, it shouldn't be there during the eating process, before that, 20 minutes before that, or right after you eat. You can always drink as much as you want. But again, Dr. William, we have a very important question that we've mentioned before, the fact that plastic surgery shouldn't be the easy solution to any overweight problem. We'd like to know, when is it a must to have a surgical intervention?
This is a very good question. To start with, rule of plastic surgery. Rules of plastic surgery depends on what is known as mass number. Mass number is it's a ratio of body weight in kilograms divided by the square of length in meter. From our own point of view, from our opinion, we said that if the mass number is from 15 up to 20, 21, this is called mild obesity. Mild obesity means there is accumulation of fat in certain areas, such as hunch, lower abdomen, upper thighs from inside or our thighs from outside. The rule of surgery here in mild obesity is just only liposuction. So the rule of liposuction is for mild obesity. Why?
Okay.
Because liposuction is an operation for adjusting of body contour.
And we're going to go back, okay.
Not for decreasing body weight, but for adjusting body contour.
Okay.
This is the first one.
And I'm sorry, Dr. Bid, because there is a phone call that's coming from abroad, I think. So we're going to take it and come back to the points with the liposuction. Hello?
Hello?
Yes, you're on air. Go ahead with your question.
Good evening, Nile TV.
Good evening to you, sir.
I'm speaking to you from Ireland.
From Thailand?
Ireland, yeah.
Poland.
Ireland.
Okay, Poland.
No, Ireland.
Poland.
Holland. Okay, welcome.
Ireland.
Welcome, sir.
Yeah, Ireland next to England. Next to Great Britain.
Sure, okay.
I agree with the doctors that sensible eating. Do not eat too much. Just eat and exercise sensibly.
You must close the TV.
Thank you very much, sir. Okay, I guess we've had his point of view. He was actually agreeing with both our doctor here that we should eat and exercise sensibly, and that's basically the way to go, to actually lead or live happily, as Dr. Al-Ghatwari said. This is basically the tip, and we definitely thank you very much for your long-distance call. So back to you, Dr. Williams said that there are levels of obesity. You were explaining where it is important to go with the mild with the liposuction. Okay.
Yes, we have started by what is known as mild obesity and said if there is a mass number between 15 and 20-21, there is only just a rule for liposuction. In second type of obesity, which is known as moderate obesity, the mass number is between 21 up to 27. In this type of obesity, there is a surgery, of big surgery, such as pendulous abdomen. In the patient, if the patient has a pendulous abdomen, as a woman has many labors, or a person athletes and stopped playing, and so on, there is a pendulous abdomen. Here, we play plastic surgery in 3 operations at the same time. The first operation is just liposuction in the anterior abdominal wall. Second operation is duplication of recti, means approximation of the muscles of abdominal wall. Third operation is excision of excess fat and skin, which is present through a small excision from the lower abdomen. This is the route of plastic surgery in the moderate obesity. But in the morbid obesity or horrible obesity or massive obesity, there is another route of plastic surgery. The rule is through application of major operations, such as application of a ring, through a laparoscope, or through open surgery. This ring has a valve which is subcutaneous. Once you inject this valve with saline or other fluid, there is restriction or constriction on the stomach, and amount of eating is less. But once we remove fluids or saline from this valve, which is subcutaneous, the stomach opens and the patient can eat as he likes.
Why would we open up or remove the ring?
This operation, application of ring, is under control. If the patient is in need to has a lot for eating, we can remove saline from this valve, which accordingly the ring will start to be widened.
Oh, okay.
You see? But if you are in need to decrease or constrict the stomach, we
go for another.
Yes, we put saline through this valve, which is subcutaneous, which starts to narrowing the wall of the stomach, and the patients cannot eat a lot.
As before.
This is the best all over the world now, is application of the ring. But there is what is known as gastric bypass, which means that we anastomose the stomach to the large intestine with or without excision of the small intestine in between. This operation can be done.
Of course.
But there is what is known as gastric stripping, which is forbidden all over the world. FDA, Food and Drug Administration in the States, started to decrease this operation for their problems. There are many problems which are later be applied to the patient.
We're going to learn all about the problems with this issue because, of course, we know that it has been very popular a few years back.
Yes,
exactly.
Yes.
So we're going to learn all about the problems with gastric stripping. But we have a caller. Hello, Mr. Mahmoud.
Yes, how are you?
Fine, very. Go ahead with your question.
Okay, I want to tell something. Okay, I'm working in a health club, and I'm and I'm exercising. Okay, I'm doing exercises. Okay, but also I have a lot of fat in my stomach. Okay, although I'm not having water during the meals. After meals, I have my water, as Dr. Munir told. Okay, but also whatever I have a lot of fat in my stomach. Why?
Okay.
I don't know why.
Okay, thank you very much.
Okay.
And our doctors will answer your question indeed. So,
the problem here is not related to this time. There's some mistake which is taken by his parents. When he was a child, they gave him a lot of chocolates, a lot of sugars, and so on. And there is hyperplasia for fats when he was a child. Now he has grown up, and his body starts, these fat cells, which are increasing already in number because of bad behavior in dealing with diet, now they start to be hypertrophied, which means increase in size. So the problem started since childhood, not started now.
okay.
So he is in need for triple, as we said, his diet control, exercise control, and there must be a will in order to decrease body weight. Otherwise, there is surgery.
Okay, very good. I hope this would answer your question. Dr. Rami, hello?
Yeah, hello?
Yes, you're on air.
Yeah, I just would like to ask the doctor about something.
Go ahead.
Yeah, actually I am a medical student. I'm a final year medical student, so maybe the talk is maybe about what I have studied, so I think I understand most of the thing, yeah.
Great.
Go ahead.
So about obesity, doctor was talking now about obesity, but when you study obesity as a disease, you feel it's like, when we study it, it's like a syndrome. You feel it's not like a simple disease, it's a syndrome. It's integrated in a lot of diseases in our community, like diabetes and hypertension and all of that stuff. So my question is it a result of these diseases, or it's like a contributing factor to these diseases? So when there is obesity, you can get easily diabetes, you can get easily hypertension, especially when you read in the books, I mean in the medical books before, you can read even in the Islamic books, Prophet hadiths مثلا, about eating, a third for your eating, a third for your food, third for your fluid, and third for your health. Yeah, you see what I mean? So just I would like to know whether it's like a cause for diseases, I mean obesity, or it's just like a result.
Point made. Thank you very much, Dr. Rami. Okay,
he wants to say it's a culprit, huh? Yeah. Each coin has two faces.
Of course.
One face is obesity, the other face is diabetes, hypertension, etc. So we can't say obesity is the result of other diseases. No, obesity is the main, obesity syndrome, as you said, is right. But it is one of the main reasons for hypertension, diabetes, cardiac problems, even depression. So obesity plays a vital role for all other diseases.
So it could definitely be a cause, like he said.
Right. Yes. Right. The main cause. Main cause.
But again, okay, Dr.
I'd like to continue and to saying that obesity is a living disease. In the last century, obesity was a symptom of a disease. For example, there is diabetes, and one of its symptoms is obesity, like and other symptoms, you see. But now, in this century, obesity is a disease, is a syndrome, as Dr. Nile said. And from its side effects, we can find diabetes. There is the reverse. In the past century, we have said that obesity is a syndrome for a main disease.
But now it is.
There is now correlation between the two. We can find that about 25% of patients of obesity suffering from diabetes. But 75% of patients of diabetes suffering from obesity. So there is interaction between them.
Excellent. Okay. Dr. Rania, hello.
Good afternoon.
Good afternoon to you.
I want to ask about needling technique for removal of scars.
Of scars?
Yes.
Okay. So that's a question to Dr. William. Are there any way to do that?
Scars is a very high problem for our plastic surgery. Scars, there are many types of scars. The problem reaches and says that if there is hypertrophic scars or what is known as keloid, you see, rule of plastic surgery is restricted at first, because once you excise hypertrophic scar or what is known as keloid, it returns back again. But there are multiple new techniques for operating for this removing of these scars. But still now, any scar, if not treated well from the beginning, there is a problem later. So the problem starting from the first closure of the scar.
Excellent. So actually, this is a call for everyone that once you get this scar, you have to operate on it, put the right, I don't know.
Right way of operation, of course.
Yes, you have to follow the right rules. And a final word, Dr. El-Ghatwari, on this very important point that was mentioned by both of you about the fact that you get those fat cells, you have the start of being obese from the very beginning, the childhood phase. Would like to know when does a parent have to wake up and see that there is a problem that has to be tackled now before his child becomes an obese person when he grows up?
I think from the school age.
Do you have a specific age?
From the school age, I mean,
6?
Yes, they start to notice, and they start to raise the spirits of activity to the child, and they start to modify his food habits.
Okay.
You know, if he used to this from the school age, he will go on, and when he's adolescent, I'm sure he will not
There's
be,
no problem.
even if he becomes fat, he will be less fat or less obese than.
If he was left without
Right.
observance.
Right.
Excellent. A final tip, Dr. William?
I think that the mother plays an important role in this type of obesity. She is responsible for her children, responsible for her wife, and so on, her husband, and so on. If she is not ready and have something related to diet control and so on,
Knowledge.
the problem starts from the mother.
So it's actually a house-related issue, and as we've just learned from our doctors, it's a lifestyle. Diet actually means living happily, so you definitely have to learn how to conduct a happy, healthy, and a good life and lifestyle as well. We want to thank our guests tonight, Dr. Munir William, Professor of Plastic Surgery. Thank you very much for being with us. And Dr. Musat Al-Ghatwari, Consultant of Endocrinology and Obesity. Thank you very much for your wonderful knowledge. And we sure hope that you've enjoyed and benefited from this edition of the program. We'll meet you again same time next Wednesday. A very good night.